South America, where at one point mass graves stretched farther than the eye could see, a reminder of COVID-19's deadly toll, is now emerging as a frontrunner in the race to vaccinate.
South America is the region with the highest vaccination rates.
Some parts of the continent now surpassing Europe and North America in inoculations. In Chile, a whopping 87% of the population is fully vaccinated. Italy and France are both at 74%, with the United States at roughly 62%. In all, South America has more than 63% of its population fully vaccinated.
South America has taken off with its vaccination. Brazil is an excellent example of how vaccination, once supply chains were secured, rolled them out very quickly and now have higher rates of vaccine coverage than places like the United States.
But in Brazil, where more than 600,000 have died from the virus, public health officials are also battling skepticism and misinformation from those in power. President Jair Bolsonaro has yet to get vaccinated and continues to publicly criticize the efficacy and regulation of vaccines.
Efeito colateral, problema qualquer, já sabe que não vão cobrar de mim.
But officials are now bracing for yet another problem.
The worst case scenario is a real substantial hit to our vaccine efficacy.
Many of the South American countries use non-mRNA vaccines like Sinovac and AstraZeneca early on in their vaccination efforts. Now, scientists say people who receive those vaccines could be vulnerable as new variants emerge.
Those vaccines did their job. Problem now is that those vaccines may be ineffective against Omicron.
Even if the region is successful in boosting its population against Omicron, the devastating impacts of the years-long pandemic won't be easily overcome. The pandemic has worsened already dire conditions in countries like Honduras, Guatemala, and Venezuela. A new report by the United Nations finds hunger in Latin America and the Caribbean is at its highest in 2 decades, affecting more than 59 million people.
What is important is to prioritize the most vulnerable groups. They had more difficult to access healthy foods than before the pandemic. And that's mostly because they don't have enough money to buy the foods and also the fear of getting COVID.
Fear that health experts in South America and the rest of the world say can be eliminated by getting vaccinated.
What we need to do is to invest heavily in boosters, and boosters not just for the industrialized wealthy countries such as in Europe or United States, but also for regions in South America. I think there's an important lesson learned that with good public health interventions, you can protect your regions.
And Priscilla Thompson joins us now. You know, Priscilla, it really seems inevitable that variants like Omicron are going to reach these countries. How are they getting ready? How are they preparing for that?
Well, Aaron, on one hand, these countries have pretty robust vaccination systems that people trust because of the infectious disease outbreaks they've had to deal with in the past several decades. But on the other hand, there is the question of the effectiveness of these non-mRNA vaccines against the Omicron variant. And that's something that researchers in these countries, in this region, are working to determine whether they should be telling officials to stock up on those mRNA vaccines, and that when people get boosted, they get boosted with those vaccines in order to offer that extra protection. Aaron?
All right, Priscilla Thompson for us tonight. Priscilla, thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.